Hello, I'm Dr. Kohei Okawa, a dentist practicing in Japan. Maybe this sounds familiar. You fix one tooth, and a year later, another one breaks. You repair that, and then a crown comes loose somewhere else. If dental treatment feels like a cycle that never ends, this video is for you. Here is why the cycle happens. When you chew, the force does not stay on one tooth. It travels through your whole mouth. If the balance of that force is off, every repair goes back into the same unstable environment. So, the repair itself may be good, and still, it keeps failing. The problem is not the tooth. It is the design around it. There is another way to approach this. Instead of repairing teeth one by one, we look at the whole mouth first. We examine the bite, the jaw joints, the bone, and the remaining teeth. Then we draw up a master plan and decide the order of treatment.
We call this a redesign rather than a repair. The goal is not to fix what broke this month. It is to build a mouth that stays stable for decades. In my clinical experience, one factor decides how long dental work lasts: the bite. Implants, crowns, and bridges all live under chewing force every day. If that force is not managed, even well-made work can break down after a few years. This is why, in a redesign, we plan the bite first. Everything else follows from it. The process has 5 steps. First, a detailed diagnosis, including CT imaging and a bite analysis. Second, the master plan, where we design your whole mouth and agree on the goal. Third, building the foundation, treating gum disease and preparing the bone. Fourth, the reconstruction itself, such as crowns or implants, in the planned order. And fifth, long-term maintenance to protect the result.
Now, the honest part: cost and risks. Full mouth treatment in Japan is private care, not covered by Japanese public insurance. As a reference, placing a single implant at our clinic costs from 297,000 to 715,000 yen, including tax. A full redesign is quoted individually after diagnosis because every mouth is different. There are risks, as with any dental treatment. Surgery can involve swelling, bleeding, or infection. Treatment takes time, sometimes more than a year. And regular maintenance visits are necessary to keep the results stable. We explain all of this before any treatment begins. So, repair or redesign? If your dental history feels like a loop, the first step is simply to know your current condition. A diagnosis does not commit you to anything. It gives you a map. Treatment is provided at Restrux Dentaria in Gunma, Japan. Thank you for watching.
This voice was generated with AI, supervised by me.